How alcohol affects your body. Alcohol affects your body in many ways. Some effects are immediate and last only a while, others accumulate over time and may significantly affect your physical and mental health and quality of life. How much harm alcohol causes your body depends on how much you drink, your pattern of drinking, and even the quality of the alcohol you drink. Your body size and composition, age, drinking experience, genetics, nutritional status, metabolism, and social factors all play a part as well. The short-term effects of alcohol. The short-term effects of a single occasion of drinking too much alcohol can include lowered inhibitions, interpersonal conflict, falls and accidents, altered behavior including risky or violent behavior, hangover, alcohol poisoning. The severity of the short-term effects of alcohol typically depends on how much a person drinks, but other factors such as hydration and food consumption also play a role. Hangover. You've probably heard of, or perhaps experienced, a hangover, a set of unpleasant symptoms that usually follows excessive alcohol intake. Most people can recognize the signs and treat the symptoms themselves. Generally, the more you drink, the higher the likelihood you'll experience a hangover, but there's no way to predict how much you may be able to drink and avoid a hangover. Some people can experience a hangover from one drink. The severity of a hangover often has to do with how your body metabolizes alcohol, as when you drink, alcohol triggers a number of reactions in your body. These reactions can contribute to hangover. They include frequent urination and dehydration, an inflammatory response from your immune system, irritation of the stomach lining, a drop in blood sugar, an expansion of blood vessels. Depending on what you drank and how much, your hangover may include these symptoms: thirst, headache, muscle aches, diarrhea, nausea, fatigue, weakness, trembling or shaking, rapid heart rate, increased blood pressure, dry mouth and eyes, poor concentration, increased sensitivity to light and sound, a feeling that the room is spinning, or a sense of dizziness, anxiety, depression, irritability and other mood disturbances, poor, restless, or less sleep. Most hangovers typically start once your blood alcohol level starts to return closer to zero. Hangovers generally only last up to 24 hours and go away on their own. Hangovers are more likely or may be more severe if you drink on an empty stomach, so it's a good idea to eat before and while you drink alcohol. Use other drugs while drinking. Smoking nicotine is known to make a hangover worse. Sleep poorly after drinking alcohol may worsen your sleep, which may in turn worsen your hangover. Drink dark-colored alcohols, such as brandy, rum or whiskey. Pacing yourself, aiming to drink 1 drink or less every hour, and drinking water between alcoholic drinks may reduce the severity of a hangover. Hangovers usually pass with time, but these tips may help to ease symptoms. Sip water or fruit juice to stay hydrated. Eat something. Plain or bland foods, such as soup or toast, may be easier on a fragile stomach. Take a pain reliever. A standard dose of an over-the-counter pain reliever such as paracetamol may ease your headache, but aspirin can irritate your stomach. Sleep it off. If you are regularly experiencing hangovers or hangovers are affecting your relationships, work or life in general, talk to your doctor about potentially cutting back your drinking. Alcohol poisoning emergency. Sometimes heavy drinking results in the much more serious effect of alcohol poisoning. This is a life-threatening emergency. Call 000 for emergency care if you see these signs in someone who has been drinking. Confusion, vomiting, seizures, slow breathing less than 8 breaths a minute or irregular breathing, a gap of more than 10 seconds between breaths, blue tinged skin or pale skin, low body temperature, hypothermia, difficulty remaining conscious, passing out, unconsciousness, and can't be woken. If someone is unconscious or cannot be woken up, they could be at risk of dying. If you suspect someone has alcohol poisoning, even if you don't see the signs and symptoms, seek immediate medical attention. The long-term effects of alcohol. Historically, it has been believed that consuming on average more than 2 standard drinks a day is what can cause many long-term health problems and other harms. Nowadays, current research states that any level of alcohol consumption can pose an increased risk of chronic disease development. The World Health Organization, who says alcohol contributes to more than 200 different types of diseases and injury. Some of the most common alcohol-related harms include road and other accidents, domestic and public violence, crime, family breakdown, social dysfunction, cardiovascular disease, cancers, including of the oral cavity, pharynx, larynx, esophagus, liver, colorectum and female breast, diabetes, nutrition-related conditions, such as folate deficiency and malnutrition, overweight and obesity, risks to unborn babies, liver diseases, mental health conditions, such as anxiety and depression, and interference with antidepressant medication, alcohol tolerance and alcohol dependence or addiction, long-term cognitive impairment, self-harm, suicide. The WHO reports that in 2016, 5.3% of all deaths globally were caused by alcohol consumption. Worldwide, more men die as a result of alcohol consumption than women. In the long term, alcohol consumption can affect all aspects of a person's life, their physical and mental health, work, finances, and relationships. What is binge drinking, and how does it affect your body? Generally, binge drinking means drinking heavily over a short period of time with the intention and result of getting immediately and severely intoxicated drunk. In the short term, binge drinking may result in a hangover, alcohol poisoning, or any of the other short-term effects of alcohol consumption, such as accidents and violence, discussed above. In the long term, binge drinking may result in any of the long-term effects of alcohol consumption, such as heart disease, cancer, liver cirrhosis, and diabetes. How to avoid or reduce the effects of alcohol on your body. The best way to avoid the effects of alcohol on your body is to not drink alcohol. This is especially important if you are trying to get pregnant, or you are pregnant or breastfeeding, as there is no safe level of alcohol use that has been identified. If you choose to drink alcohol, low-level drinking is better for your body than heavy drinking or binge drinking. Australia's national guidelines to reduce health risks from drinking alcohol from the National Health and Medical Research Council say that the lifetime risk of harm from drinking alcohol increases the more you drink. For healthy men and women, they advise drinking no more than 10 standard drinks per week reduces the lifetime risk of harm from alcohol-related disease or injury. Drinking no more than 4 standard drinks on any one day reduces the risk of alcohol-related injury arising from that occasion. The less you choose to drink, the lower your risk of alcohol-related harm. For some people, not drinking at all is the safest option. It is important to monitor your alcohol consumption as part of a healthy diet. Alcohol consumption has the potential to cause weight gain and obesity, depending on how much someone drinks, the type of drink consumed, as well as the makeup of each individual and a number of other interpersonal factors. Source: https://www.betterhealth.vic.gov.au/health/healthliving/how-alcohol-affects-your-body.